if I take you a little bit backwards, so while you were doing those surgeries where you were basically rehabilitating the defect with the bone, what was your success in terms of you finding success in terms of what you've done? Like you said, you couldn't give the patient teeth. Actually, the patient was not getting the teeth. Only the gap was being bridged. You did have implants, but then you didn't have the exact positions. Like you didn't have anything which is called as critical surgical planning at the moment. So what did you call success at that time? Because it's been quite a while.
Yes, it's difficult to say because, at the beginning we were already happy just to reconstruct the defect with the free flap, and the free flap survived. Because at the beginning of these surgeries, we had quite a high, so everybody had quite a high failure rate, and so we were already happy if the flap survived. But then, from a certain point on, when we saw, okay, so if we do the surgery correct and the anastomosis as well correct, so then the flap survives absolutely smoothly. But then the next step is, now how can we do the reconstruction for the patient that he can really chew and he can really smile and he has a correct prosthesis that is fixed. And this was the point where we started, okay, now we have to change something because it doesn't work really.
So right now, do you start from the occlusion and from the functional aspect and then go back towards reconstructing the bone actually?
Yeah, exactly.
Reverse engineering the defect entirely.
So see you next week once again with another episode of Surgeons in 3D Printing. Till then, stay safe and live with passion.